Radiation therapy is a necessary treatment for stage 2B and greater cervical cancers. Unfortunately, radiation therapy injures neighboring pelvic tissues, resulting in urinary incontinence. Now, the pathological mechanisms responsible for this progressively worsening condition remain unknown. So the question we want to address is, how does a single dose of radiation impact bladder and urethra contractions? To determine this, we expose female Sprague-Dawley rats to a single fraction pelvic radiation dose, and then we assess these animals at 4 weeks and 9 weeks post-radiation therapy to monitor for any progressive changes. For clarity purposes, we pooled our age-matched controls. At these terminal time points, we excised bladder, internal urethral sphincter, and external urethral sphincter from each animal and assessed ex vivo contractility using a myograph system. Specifically, we measured contractions mediated by pharmacological agents as well as electric field stimulation mediated neurotransmitter release. In the bladder, we see no changes in contractions mediated by a potassium chloride solution, which just causes cell depolarization, or specifically a muscarinic agonist, in this case carbachol. However, when we apply electric field stimulation to the bladder, we see that neurotransmitter-mediated contractions decrease at 4 weeks and 9 weeks post-radiation therapy. Moving distally to the internal urethral sphincter, we actually see a similar trend in agonist-induced contractions. Like the bladder, there was no changes in potassium chloride-mediated contractions, and here we also don't see any changes in caffeine-mediated contractions. When we applied electric field stimulation to the internal urethral sphincter, we actually see a temporal increase in contractions in our 4-week group. However, these contractions returned to baseline by 9 weeks. We performed these experiments in the absence and presence of dantrolene, a ryanodine receptor antagonist, to determine if there is any striated muscle involvement. Here we see that dantrolene had no impact on contractility, signifying that this is not the result of striated muscle. We then assessed the external urethral sphincter. Unlike the bladder and internal urethral sphincter, contractile force mediated by potassium chloride and caffeine actually doubles in our 9-week radiation therapy group. Likewise, when we apply electric field stimulation to the external urethral sphincter, we actually see that contractile force increases in both the 4-week radiation group as well as the 9-week radiation group. However, this time, when we incubated the tissue with dantrolene, we actually see a significant reduction in the contractile force. This signifies that the increases in force are due to striated muscle involvement. Lastly, we incubated all 3 of our tissue types in tetrodotoxin, which is a sodium channel blocker, and performed electric field stimulation. Here we see that in the presence of tetrodotoxin, it virtually eliminates EFS-mediated contraction, confirming that the source of these contractions are from neurotransmitters. In conclusion, we see impaired neurotransmitter-mediated bladder contraction following a single radiation dose. However, in the internal urethral sphincter, there is a transient increase in electric field stimulation-mediated contraction, which is followed by resolution by 9 weeks. However, in the external urethral sphincter, we see increased contractions mediated by both agonist as well as neurotransmitter mediated. So therefore, overall, a single radiation dose will decrease nerve-mediated bladder contractility, yet urethral sphincter contractile force actually increases.